In this last video, I'm going to walk you through some of the tabs that I did not get a chance to show you in the previous videos. Let's go ahead and start by ICD-10 CMPCS. So again, from the diagnosis side, if you remember from ICD-9, we used to refer to this classification of V codes. So if just as we have in the ICD-9 coding box, if you trying to look for a V code type of code, so you, for example, I say status post, and you come up with these classification codes that we used to refer to Z codes, ICD-9. Most of these codes come out as Z codes. For example, someone is using insulin for long term, you just need to look up long term and then comma put insulin, and you get your code here. As usual, you go ahead and click on a code, verify the code in a tabular, and then you get the right code. The next tab is for drugs. This is where we worry about poisoning and adverse effects. For example, suppose we worried about adverse effects of anesthesia that was administered epidural. So you have to put anesthesia and then go to epidural. So we need to make sure you have the right adverse effects. So we have anesthesia, epidural, and we click on the code. We go to the tabular. Because our code is red, we know that we need additional digits, the 7 digits. So once you click here once, the system will give you choices for the last digits of the code, the 7 digits of the code. Again, remember these X's are placeholders. The next tab, where it's external causes, that if you remember, these are referred to as E codes in the ICD-9. So suppose you worried about some sort of collision, so you type in collision through the external cause tab, and then you get a mandatory, no, not mandatory, an instructional that says to see accident transport. So you go ahead and type in accident, comma, transport, and then you give a variety of choices about different type of collision that might happen. So then you click on any code that's appropriate based on your documentation. You go to tabular, the code is red, you know you need more digits for the code. You click on the code and the system gives you more choices, and sometimes with the placeholders in there. The next tab is for neoplasm. Again, because this is a neoplasm table, all you need to do for the for 3M here is type in the site where the neoplasm is. Suppose say skin, you get different choices based on whether the neoplasm is malignant, inside to benign, and you be seeing this in the mini lectures. So you can type in any site, and just as you would in looking in a book in ICD-9 or even ICD-10 CM book, and then it gives you choices based on your site. The procedure, we did cover this, but I shall go ahead and cover the procedures on ICD-9 just to give you a perspective. So again, you go ahead through ICD-9. You get diagnosis where you can look up your V codes. So you want to look up long-term use of some sort of drug, antibiotic, whatever. You get your V codes. You go to the tabular. You read through your instruction notes. You assign your code. The same thing applies here for your drugs. All you need to put in is put in your drug, and the system, gives you whatever you need to have. For example, the patient had aspirin poisoning. You type in aspirin, you look for a type for poisoning, and you get your code. You click on there, you verify the code in a tabular, and then you get your right code based on instruction notes. So again, the E codes, it's external causes where if you want to look up accident, you just type in accident, maybe motor vehicle, and then you get several choices for what you need. You click there, you go to your tabular, you verify the code, assign the right code. In terms of procedures, this also works just as you use your index in diagnosis side, in terms of ICD-9. So you type in, for example, excision. So you get choices of subterm based on your documentation. You choose the appropriate code. You go to the tabular for ICD-9 procedure, and then choose the code base and instruction notes of the category code. So this covers most of what you need to know for this class. There's additional resources that you might find. For example, especially I want to show you the resources on ICD-10. If you go to Help tab, you get this links that send you to especially what you need to know, which is ICD-10 PCS coding guidelines. So once you click here, you get the guidelines there. Not that I want to memorize these guidelines, but you really will use them across, throughout the semester. So take some time, read through this. Also going to post this in the mini lectures. Be familiar with this, so as you're coding through the PCS procedures, you understand what these guidelines are. So go ahead and look through 3M and practice as many examples as you can, and let me know if you have any questions.